I'm Terranova, CEO of Quad A. I'm here to talk to you today about compliance in your dental practice. Many of you may have seen our name or heard us talked about at some of the AAPD meetings recently, or seen us sitting around in the exhibit hall. Some of you may even be aware of our program. That's why we're here to talk to you. We've been working with AAPD since about 2016, 2017, at their request, to create an accreditation program specifically for you, for pediatric dentistry, and the unique challenges that you all face in serving the community. Quad A has been a patient safety organization since 1980, and for that reason, and in conjunction with all of the various problematic media reports and tragedies that we've heard around the country, the AAPD leadership thought it was incredibly powerful and incredibly important to create an accreditation program that served your needs and made sure that you were providing the best care to your patients, and further, to differentiate you, the AAPD community, specialists who are trained in providing this care safely, from those who maybe don't have the appropriate training, don't follow the appropriate protocols, and don't have the appropriate physical setup in their facility to safely treat children under sedation. So what I want to talk to you about today is compliance in your dental practice, so that you can think about accreditation, the importance it holds for you, and how to achieve it. And even if you don't go through the accreditation process initially, how to just improve your practice incrementally to provide safer care to patients. Our peer-based program and educational approach are distinguished by four major components. We have a 100% compliance mandate. That means that for every single standard that Quad A has written in conjunction with AAPD, we expect every clinic who becomes accredited to actually comply with every single one of those standards. And that means if we write up a citation, the facility has a plan, an opportunity to correct that citation with a plan of corrective action and evidence of corrections. So eventually, by the time we put the stamp of approval and our certificate on the facility's walls, we've understood and that facility has demonstrated 100% compliance. The second piece that really differentiates the program is our data reporting. Every year, every practitioner must report certain data into our system that we can then look at from a population level to prove out safety for the patients. Third is we require appropriate training and specialty certifications to be able to perform the services in your office setting. And that's somewhat unique because in some other organizations, in some other regimes, or certainly in facilities where there is no accreditation or certification, people may do things that they have not had explicit training in. And the fourth is that Quad A requires evidence of corrective action for every single deficiency that we cite. So as I said before, you may get cited for a deficiency if we come in to do a survey. You have an opportunity to establish a plan of corrective action, but we actually want to see that the corrective action was completed. And that's really important because especially in small facilities, we believe this sets you up for long-term success. We all know what it's like to go to a meeting and come up with a great plan and have an idea of how to execute something, but then to let it fall down, to fall back into our habits, to get busy, and then to not carry out that process or that procedure. So for that reason, Quad A wants to see the evidence come into the office. We want to work with you and know that you have done everything you can to set your staff, your facility, and yourself up for success long-term to make sure that you can maintain compliance ongoing. We started all of our work 40 years ago. We started our work internationally over 20 years ago, and we started our work with AAPD in 2017. We've been in it for the long haul. Obviously, COVID kind of threw us all off and we didn't get to launch this program, but now what we're trying to do is really educate the entire membership on how to become a part of this program and really the challenges that they're going to face in terms of giving safe care to patients in a way that separates, again, the AAPD community from those who choose not to become accredited. Patient safety is universal, especially for your young patients. It's really important to understand that an airway is an airway, whether it's in Chicago, Miami, or elsewhere around the world. And what we do to protect an airway or a patient's vitals or to recover them after sedation is really important. And it's really important to know that we're following the same protocols, that we're following the same procedures, and that we're documenting all of these. The way safe care can be verified is by accreditation. Because this is an impartial, arm's length process, it creates trust among regulators, parents of pediatric patients, and the patients themselves. Obviously, for many of your patients, they're young, they're not making their own decisions, but they are scared. And whatever we can do to inform the patient, their parent, their guardian, their stakeholder, whoever it is, that we're doing everything we can to treat them safely, it just eases everybody's mind. It allows for a better care environment and better recovery. And if God forbid something bad does happen, if the risks of surgery, the risks of sedation come through and there is some minor incident, you'll be best equipped to recover that patient, to ease the emergency, and have developed trust with their families to know that you did everything possible to prevent any sort of risk or mitigate the risk, and everything to recover the patient in the case of an emergency. And again, this also carries weight with regulators because it is not a situation in which a society is developing its own standards and its own standards of practice and guidelines. This is an impartial third-party process that is more trusted as an external quality assessment. And so there is a broader implicit trust with regulators that it's not just colleagues passing one another and giving each other acknowledgments. Every patient deserves a demonstration of safe care with interacting with all members of your staff. And this goes whether you bring in anesthesia on a contract periodic basis or whether it's full-time in your office every day. There's an inherent value attached to patient safety. No parent wants their child to wind up as a cautionary tale. Deep down, they want to make sure that if they choose to have them undergo a sedation dental procedure, it won't cost the child their life. There are, of course, many more concerns, but almost all of these concerns come back to the psychological and emotional needs of parents concerned for the children's safety. If you ask any parent, or any patient for that matter, what their deepest concern is when undergoing any medical or dental procedure, especially under sedation, it always, if you kind of dig it, it comes back down to they don't want to pass away. They don't want to face the ultimate risk. And we all know the moral obligation to avoid tragedies, but there are practical benefits to following best practices in key areas and communicating honestly and proactively with patients of parents about the best practices to ensure that they are aware of the lengths that you go to in order to treat them in the best way possible. This will only improve the parents' view of your center and provide them with additional confidence to choose your center, promote you, and refer others to your care. So there is a self-interest here on top of the moral obligation. Before I get into the specific challenges and pain points for pediatric dental facilities that we've already accredited, so your peers and your colleagues who've gone through this process already, just a general overview of accreditation will tell you that we test hundreds of standards. So compliance, especially 100% compliance as mandated by Quad A, involves demonstrations of appropriate documentation. You can see these on the slides that I've provided. Appropriate processes. We observe processes. We observe care. We want to see your staff at work, what they do on a daily basis, both with the patients and with their other workflows. And we also look at the physical plant and environment, what your facility looks like, how clean it is, how well maintained it is. This goes to equipment and supplies as well. All of these things make up the total universe of pieces and elements that allow you to provide safe and effective care for your patients. If you don't pass 100% of these standards, we can help you achieve compliance with those standards so that you can provide the best care for your patients. This is a comprehensive process that involves 600 or 700 standards if you're providing general anesthesia, probably 500 or 600 standards if you're providing sedation. And no patient, very few regulators, no referral source is going to come into your office and check each and every one of these elements. But what we can do and what you can do through demonstrating your compliance is give an easy answer to all 500 or 600 of these technical questions that you are a safe practitioner and you have their children's best interest in your mind always. Although this is a new accreditation program and relatively early on in its life cycle, and some of you may be learning about it for the first time, several of your colleagues and AAPD members have gone through the Pediatric Dentistry Accreditation Program. What we've been able to do is analyze and compile the data from our surveys of their facilities to understand what are the most common deficiencies, what are the most common challenges, what are the unique areas that trouble pediatric dentistry facilities. Even if you're not ready to go through accreditation yet, it's important to know about these challenges because they provide a smell test for you. We all are very easily become immune to the things that we do on a daily basis and maybe not always see the challenges that present themselves in our practices. Things that you may forget, things that you may miss, things that maybe staff turnover has caused to fall through the cracks. So I like to use a slide like you see before you to really serve as a prompt for you. even if you're not going to go through accreditation yet, you can go back to your office, think about these things, and assess your staff and your operation from an arm's length to understand if you also struggle with these elements and what you can do to solve those struggles. So very early on, you can see that the standard text relating to hazard safety training, bloodborne pathogen training, universal precautions training, and other specialty training such as operation of the fire extinguisher and other sort of rescue equipment are commonly cited as deficient. And really this exists across all practice types, all specialties, and really all of our programs. It's not limited to pediatric dentistry. Specifically, what our surveyors tend to find is that if people are on staff at a hospital, the center will rely on the hospital training for hazard safety, for bloodborne pathogens, et cetera. They will not offer training, especially small practices often do not offer training to their own staff. Or we will see no documentation. Often we'll interview staff and they'll tell us, yes, we have training once a year, but when we look for the records, we don't see it. And anybody who's worked with a nurse for more than, I think, 5 minutes has heard the term, if it's not documented, it's not done. And I think that's a really important demonstration of compliance is the documentation. Every healthcare provider and dental care provider in the world has trained to treat patients, to assess patients. No one likes to go through checklists, but they are incredibly important, as has been taught to us many times by the aviation industry. And I think that's a really big analog that has made its way into healthcare, is taking the checklist culture from aviation and making it something that's routine in healthcare. So again, documentation of the training is critical. Often we see that smaller clinics particularly will train staff on hire, but not periodically thereafter. So you'll see someone learn how to use the fire extinguisher in an orientation training, but then there won't be annual reappraisals or trainings. It's really critical to make sure your staff's knowledge stays sharp. And again, we'll see often that records are empty or missing when we look at personnel records specifically related to training. Keeping on the theme of documentation, we often see the lack of records for immunizations, especially for hepatitis B or other exposure risks. We'll see lack of health hazards and precautionary measures for employees that might have a communicable condition or be exposed to communicable conditions. And then again, general inoculations and refusals. Again, the lack of documentation of refusals or inoculations, lack of documentation of health problems, these are all critical. Most states, most licensing bodies require certain of these to renew your license, but that doesn't absolve the organization from keeping a record on site, because as an employer, as a medical director, as a director of a facility, you need to be aware of when your people's inoculations need to be renewed, when their trainings need to be renewed, and you may have a staff of 10, 20, 30 people, and all of their dates might be different. So it's really important not to rely on the outside sources, but to really be internal with this and have some structure there. So don't rely on government licensing either. That's another common finding. Specifically when you're using controlled substances in inventory sedation, the log is really important. And to have a controlled record of your use of the log within the facility is incredibly important. So especially for those of you who use contract anesthesia, who only comes in periodically, say you only do your sedation cases once a week or a couple times a month, and you're bringing in contracted anesthesia, we see a lot of variation in how those practices work. And it could be that the anesthesia provider wants to take records of all the controlled substances used with them, and they have a central location where they store their controlled substances, or they control the records. Well, there are myriad troubles with all of that, and we can get into all of those in a different talk. But the truth is that you need a log that is tamper-proof in your center for the controlled substances that are provided in your center. Because if contracted anesthesia leaves and you have some reason that you need to audit what was given in your center, you need to know what that is without having to contact that anesthesia provider. So you need to make sure that those logs are in the office and that they're maintained with your practice, no matter what happens to anesthesia. They need to be tamper-proof, which is incredibly important, especially with drug diversion these days. Tamper-proof logs are incredibly important. Sequential numbering of either entries or pages is incredibly important, so that contributes to the tamper-proof nature of those logs. If you're using electronic logs, that's fine. They don't have to be paper, but what our surveyors often find is that the electronic logs do not have an audit trail or are not necessarily password protected or have other methods to keep people from editing and deleting entries. So especially for those of us who don't have sophisticated practice management software. It's really easy to use a spreadsheet. But if that spreadsheet is just a bunch of entries and there's no protections and passwords to control who's entering data, who's manipulating data, and who's deleting data, it becomes a real hazard. Again, with diversion, this has been exacerbated tenfold. The last thing is records in practices, particularly where there's contracted anesthesia, we find that there's missing administration details. There's missing details in the log that should indicate the patient, the substance used, the amount, the time of administration. So sometimes we'll see records that indicate that the drug was given, but they're missing all those critical details. All of those are elements to make sure that you're safely tracking the patient through the administration and recovery from anesthesia. To adhere to various standards, it's crucial to maintain detailed meeting minutes and documented rationale for any leadership decision, policy changes, reviews, trainings, projects, and this includes studies or surveys that you do related to patient satisfaction or quality. This is more of a general finding that we see spread throughout our governance and our policy documentation, our emergency preparedness documentation. What accreditation and often government agencies want to see is that your leadership has made a reasoned, well thought out decision. We're not necessarily prescribing what decision needs to be made, but that the leadership of the organization with their expertise and training has gone through a thoughtful process to come up with a resolution. So for us, anytime we see calls for committees, calls for projects, calls for meetings that should take place periodically, it's really important that there's a record of follow-up, potentially feedback loops within meeting minutes, that there's assignment to a responsible party, that there are a listing of the participants who were there. You should include anesthesia, even if they are contracted, because they are a critical part of the care team. So if your meeting is just between the facility director and the nursing staff, great, we should know that. If you're including the anesthesia provider, we should know that as well. And again, decisions made without a documentation of the rationale or the consideration are common findings for us, but they leave us wondering how you came to that solution. Whether it's picking what kind of natural disasters you're going to prepare for in your emergency preparedness, or what kind of quality assurance projects you're going to undertake, it's really important to know why. If you struggle with hand hygiene and you're going to do an audit on that, it's important to know that that's why you chose hand hygiene. The key takeaway, as you might imagine from this presentation, is that documentation is a persistent problem across all specialties, across all care provider types, across all setting types, and across, whether it's a medicine or dentistry. It is always a problem for every facility of every size to maintain the documentation. I've been with Quad A since 2009, and whenever we run our list of the top deficiencies in any kind of setting, at least 80% of them refer back to documentation. Dentists, you are not alone in this. You are trained to treat, not record, and it's just different mentality, and it's against all of your sort of natural tendencies to try to record every detail of your day when you're trying to run through your busy practice, keep it running, and keep your patients served. All of these documentation challenges are exacerbated in small clinics. Time constraints hinder your proper recording. Small meetings and trainings are very common. It's very easy to go through and say a doctor wants to do this, doctor wants to do that, and then run off to actually execute it. It's really difficult to have the discipline to go back and document why that decision was made and to solidify it. But it's incredibly important because if a nurse comes in the next day who wasn't a part of that flyby meeting, there's no consistency in your staffing. So it's really important. Obviously, large committee meetings are impractical if you have a solo practice, but you still want to have some sort of organizational structure that allows you to be consistent from week to week, day to day, and month to month. Dentist preferences have historically guided the practice. If you're a smaller solo practice, whatever you want to do as the practitioner is really what the staff does. But again, that can change on a whim. Accurate documentation safeguards against adverse events, bad press, and legal problems. That's just the facts of it. All of you are aware of tragedies in your own states and across the country. It's really important as a society, as a practice specialty, as a whole sector of the healthcare community, that we together guard against this, because you provide a vital service to the community, and we want to make sure that we aren't creating problems by having unintended consequences from gaps in care and gaps in operations. Protocols hold a significance. If you document and adhere to them, you will be protected, you will operate a better practice, your patients will be better served, and your patients will be safer. Be vigilant about the details. Thank you again for joining me for this brief overview of the project, the program, and compliance in a pediatric dentistry facility. I know there will be plenty more opportunities for you to investigate and learn more about the accreditation program and why it's so important to you as a specialty and to all your patients. In the meantime, if you have any questions, please don't hesitate to contact me or the AAPD leadership, who can put you in contact with our office to discuss the importance of accreditation, how to go about it practically, and the mechanics of the process. In the meantime, please take what we've talked about today back to your practice and look into it to see where you struggle. We're always here to help, and we're always happy to help you through to compliance.